All right, we're right about at the top of the hour. Good afternoon to everybody on the East Coast. Now that it's 12 o'clock, to everybody that's joining us from the Central and Western and Mountain time zones or other parts unknown, good morning or good evening to you. We'd like to thank everybody for joining my partner Mary Pat and I today for the Manage My Practice webinar, Making Your Voice Heard, a beginner's guide to communicating with the people who impact your practice. My name is Abraham Whaley, and I just want to start today with a few technical details before the program begins. If you have any questions during the program, you can go ahead and type them in the chat box that's at the bottom of your GoToTraining viewer. To open the box, you just click the plus sign next to the word chat on Windows machines or the arrow next to the word chat on Apple devices. There's also a pull-down box next to the chat, so you can address questions either to the entire audience or just to me if you'd prefer to remain anonymous. Today's program will last about 45 minutes of teaching, and then we'll leave the last 15 minutes for questions and answers. So go ahead and type any questions you have in as soon as they come, and I'll pass them along to our presenter. Today's presenter is Matthew Tabor. Matthew Tabor is the Chief Operating Officer of Medical Access USA, a direct primary care management company, and a former Congressional Health Policy intern to a member of the U.S. House and the United States Senate Help Committee. Medical Access USA manages the implementation of direct primary care health networks that are designed to give physicians 100% reimbursement for their fees for medical care and grant full access of medical care to all patients. Good afternoon, Matthew.
Good afternoon, Abraham, and good afternoon, everybody. As Abraham said, my name is Matthew Tabor, and I am a former congressional intern to a member of the U.S. House and to the U.S. Senate Health, Education, Labor, and Pensions Committee. I was an intern for a member of the House back in 2007, and I was a health policy intern to the United States Senate Health Committee back in 2008 when they were starting to draft a health care reform. And it is my pleasure today to give you all the secrets of how to advocate to Congress and to state legislatures. So let's dive in. So first of all, what is advocacy? Well, so for starters, by definition, advocacy is the act of pleading, supporting, or recommending. So in political terms, it is also a political process by which an individual or groups aims to influence public policy and resource allocation decisions within political, economic, social systems, or institutions. So what are some things that you should advocate for? Well, there's a lot of different things that you can advocate for. But for example, some of the things that are being advocated right now in the United States Congress is the Sustainable Growth Rate repeal, aka the Docs fix, telemedicine, increasing access to telemedicine, ICD-10 repeal and delay, improving access to trauma care and improving trauma care in general, increasing access and improving newborn screenings, and increasing and improving long-term care insurance. These are just, again, to give you an idea of some of the current issues that are physicians and medical practice executives are currently advocating for in the United States Congress. So where should you advocate? Well, there's a lot of different places you can advocate. Locally, you can advocate to your local councils, your local city councils. You can advocate to your local health departments, your state legislatures, the Congress, and the federal government itself. So before we go any further, it's best to understand what the three branches of government actually are. And so if you will go back down memory lane with me, and if you don't mind me giving you a little explanation here, if you'll bear with me as I do this. But as you know, there are three branches of government. There is the legislative branch, the executive branch, and the judicial branch. As you know, it is the legislative branch that creates the laws. It is the judicial branch that interprets those laws. And it is the executive branch that carries out those laws. Now, the structure is the same at both the federal level, the D.C. level in other words, as well as the local level and at the state level. All three branches are the exact same. So let's specifically talk about the U.S. Congress, that is. And as you can tell, the House, there are two chambers, the House and the Senate. The House is made up of 435 members currently. The U.S. Senate has 100. The United States House is currently controlled by the Republicans. The United States Senate is currently controlled by the Democrats. The House and the Senate have leaders in them. The leader of the House is known as the Speaker. The current Speaker of the U.S. House is a congressman by the name of John Boehner, who is from Ohio. The person that leads the Senate, he is known as the President. The current President of the U.S. Senate is the Vice President of the United States, and that is Vice President Joe Biden. So in Congress, you have committees, and these committees are actually the ones that actually write the bills. They're the ones that write those laws, and they write big bills. And I'll kind of explain about big bills and small bills a little later on. But the committees, they write big bills. So the individuals that actually wrote the Affordable Care Act, also known as Obamacare, as well as some other words as well, that particular law was written by the committees. And now specifically, since that is a health care law, that law itself was written in about six different committees. And there are 6 different committees that handle health care policy. So on the U.S. House side, you have what's called the Appropriations Committee. The Appropriations Committee controls the flow of the money. They authorize money getting spent into the general public. So that's that committee. Then you also have the Ways and Means Committee. And the Ways and Means Committee are the tax guys. And then you also have the Energy and Commerce Committee. The Energy and Commerce Committee deals more with issues that do not relate to financial issues. On the U.S. Senate side, you have, again, the Appropriations Committee. You have the U.S. Senate Finance Committee. And you also have the Health, Education, Labor, and Pensions Committee, which is also simply known as HELP for starters. For short, I should say. So I've mentioned the committees and what they do. Now let's talk specifically about the actual members in Congress. In regards to health care, there's actually 27 members who actually are in health care. There are 7 nurses and there are 20 physicians. On this particular slide that I'm showing you are 7 nurses. These nurses, there are 4 of them are Democrats, 3 of them are Republican, and you can also tell what state they actually represent. On the next slide are the physicians. On the actual next 2 slides are the physicians. In the U.S. House, again, there are 17 physicians in the House, 3 on the U.S. Senate side. Overall, 17 physicians total are actually Republican, along with 3 of them are actually Democrats. On the Senate side themselves, I did mention that there are 3 current physicians in the U.S. Senate. Their names are Dr. Tom Coburn. He is a family practice physician out of Oklahoma. Dr. John Barrasso is an orthopedic surgeon. He represents Wyoming. And Dr. Rand Paul, he is an ophthalmologist, and he represents Kentucky. So we've already discussed the committees a little bit. Now let's talk about the actual congressional offices themselves. So first of all, we first need to understand the actual anatomy of a congressional office. The congressional offices themselves can range from having 10 staff members to over 20. Your House congressional offices are very small. They usually have about 10 staffers. The ones on the Senate side wind up being a lot larger. They can have at least 20 or even more. So within these offices, you have certain staffers that have certain roles and certain titles. The titles that are that a lot of them mainly have, that's normal titles for these members to actually have, would be a chief of staff, your legislative director. The legislative directors, by the way, actually are in charge of policy, and they control how policy is actually developed, and they decide what policy that their particular office is going to support or not. In addition to that, you have what are called legislative assistants. Legislative assistants write small bills, as I mentioned before about big bills and small bills. Big bills are handled by committees. Small bills are handled by legislative assistants. Legislative assistants will write small bills. They will write resolutions. They will write amendments. So you have the legislative assistants. Then you have what are called legislative correspondence. So I'm sure from time to time you all have gotten letters from your congressman or senator because you have written a message to them directly, and they have been able to give you a response back. Believe it or not, these letters are actually written by the legislative correspondents themselves. And the legislative correspondents, whenever they write a letter back to you, the congressman is actually dictating them what to write to you. So the congressman does look at the letter. He does see what is being sent to him, and then he tells his legislative correspondent to write you a letter, and he dictates that back to that legislative correspondent. So that's what the legislative correspondents do. Then you also have your communications director. And the best way to look at a communications director is that this person controls the message to the general public. It is their job to get the message out to you, the public. That's exactly what they do. Another way to look at them is that they are a PR person. That's a great way to look at what the communication director actually does. Then you have the staff assistants. And the staff assistants are the first people that you see when you walk in that door of the office, and they are the first people that you reach out to on the telephone. They're the ones that will be answering that phone 99.9% of the time when you call that office. All right, so we've talked about the anatomy of a congressional office. Let's now talk about the anatomy of a congressional committee. Now, they have very similar titles, but some of them are a little different. So, for example, on the Congressional Committee, you have your staff director, who basically just is in charge of that entire committee. You have your legislative director. They oversee all of the policy for that committee. You have your chief counsel, and counsel is just a fancy schmancy term for lawyer. You also have your communications director. You have your clerk, and the clerk does a variety of different things on the committee. They help support the staff, and they help set up hearings. Then you also have your director of IT, and the director of IT is responsible for videotaping the committee hearings, and as well as for maintenance of the actual committee website. So below on the bottom of the screen, I give you an example of my former committee, of the U.S. Senate Health Committee, that is. So on that committee, we had a staff director for health, we had a director of health policy, we had a health counsel, we had professional staff, we had a research assistant, and we had a staff assistant. Now, the professional staff are, in a way, are kind of like legislative assistants. They help actually draft and put together the laws themselves. So let me just give you a brief little example here, exactly for how the policy is actually developed in this country. So how policy is conceived in this country, if I may use that analogy, is that it starts with a simple idea. Anybody on that committee can have an idea. I myself, an intern, can have an idea. My staff, the staff assistants can have ideas. Anybody that you can possibly think of can have an idea. And so what will happen is whoever has an idea will write a little email to someone on the staff and say, okay, I have this great idea. I want to help. I want to change the world here. I want to do this, this, and this. I want to do something here. So they will write out that idea. Then what they'll do is when they write out this idea, it's in a memo form, but it's not in a paragraph form, if that makes sense. It's in very bullet point form. It's very short, sweet, and to the point, and it's in bullet point form. It's in talking points, in other words. That's what that is. Those are talking points. And they will send out that message about the idea. Then what will happen is that message will go to the senators on the committee, and it also will go to the committee chairman himself, or also the ranking member as well. And so it'll go to those individuals, and they will say, okay, we give your blessing to move forward with this idea. And then the staff says, great, excellent, all right, let's move on. So they move on with that process. From there, what happens is you go into research mode, and the research assistants will start researching that idea further. They'll go into the Library of Congress. They'll look all over the place. Excuse me, for research, and they'll start researching that idea. From then, once they got the research, the professional staff take over, and the professional staff will say, okay, here's the research. Now let's try to shape it. Let's try to shape an actual piece of policy here. Let's try to shape this legislation. And what they will do is they will start to slowly but surely write out what are called provisions. And they will write those provisions into the bill. Well, in this case, it's going to be a piece of paper. And so they start writing out the bill in bullet point form with those provisions. And then what they start to do is then they reach out in the community and say, okay, let's reach out to the experts here. So, for example, if we're talking about a pediatric piece of legislation here, what they would do is they would reach out to the pediatricians that they already know, and they would reach out to people in the community and say, hey, you know, we're working on this piece of legislation. We think it might want to do this. What are your thoughts about it? What do you really think about it? When they're doing that, that's called taking the temperature. They're trying to see where people stand on that particular issue. From there, what they'll also do is they'll reach out to even more experts. They'll reach out to, in this case, since we're talking pediatrics, they would reach out to the American Academy of Pediatrics, and they would speak with the leadership of the AAP and get them to weigh in on this issue there. So once they've talked to all their experts, then they say, okay, we're going to go back and now we're going to continue working on the bill and we're going to make it better. Then when they feel like that they've gotten to the bill the way that they want it, they then wrap it up and they send it to what's called the Legislative Council. Now the Legislative Council is made up of lawyers. The lawyers and the Legislative Council are the ones that whenever you go and read that bill, all that goobly-golly-goo stuff that you see is the Legislative Council themselves. Those are the lawyers. When we, the staff members, draft laws, we do not put it in that language that you see. By the way, what I was referring to, the googly-golly-goo, that is called legislative language. We, the staffers, do not put in that language. The Legislative Council does. So just so that you all know who does that, it's the Legislative Council. It is the lawyers that put in the googly-golly-goo. So once the lawyers put in the googly-golly-goo, they will then send it back they will bring it back to the committee, and then the professional staff, along with the clerk of the committee, will then develop a hearing, and they will then take that bill and they will put it before the full committee. They will then bring in experts that they've already been speaking to. They will hold a huge committee hearing. Once that happens, and once the committee happens, then they will hold another session, and that session is sometimes called a working session. It's also known as a markup session. And what happens there is the senators, in this case, at that time, will go through that bill and literally mark it up. They'll say what they like and what they don't like. And they will start voting on provisions, and they will start voting on amendments. And then at the very end of that process, and if it gets voted out of the committee, then at that point it will finally reach the floor of the Senate, and it will then be introduced onto the Senate floor by a member. And usually this member is the sponsor, and that is the main person that most of the time came up with the idea as who the actual sponsor is. So that, in a nutshell, is how the legislative process works. That is how our pieces of legislation are conceived and are born. So again, when I was mentioning back to the staff again, as I was saying, on both the Congressional Committee as well as the Congressional Office, there are key staffers here. There are the legislative assistants, and for the individual offices, and for the committees, they are the research assistants slash professional staff. Now, why am I telling you these are key? Because these are the key individuals, again, who you will want to target when you advocate. These are the first people you want to talk to. You don't want to talk to anybody else. You want to talk to those main individuals, because these individuals not only write the laws, they have the ear of the person they represent. In other words, if it's a legislative assistant you're talking to, that person has the ear of the congressman or senator that they work for. That is their boss. On the Congressional Committee, it works the exact same way. They will have the ear of the senators that they work for on that committee. So these individuals are extremely important for you to reach out to. And these are going to be the ones that are going to be able to help champion your idea and help get your idea through to Congress. So, okay, so back to the advocacy process. This is a 3-step process with 6 smaller little processes in between there. So first of all, step 1 is you have to identify your issue. In this case, we'll just assume you have. The second step is to go and research your issue. The third step is you want to contact Congress. Number 2 is very, very important. Before you even contact Congress, you want to make sure that you've done extensive research on your specific topic. So so I hear you all asking me, Matthew, how on earth do I do this research? Well, there's several things you want to do. Number 1 is, first of all, you want to see if there's any pending legislation on your actual topic. If there is, that's great. You go and tell Congress about that, and that's going to help you out. If there's not, no big deal, and we can talk about that later. And how do you find this pending legislation? Well, there's several different ways. One way is you want to start out with the professional organizations, such as the American Academy of Pediatrics, the American College of Healthcare Executives, the Medical Group Management Association, the American Hospital Association, et cetera, et cetera, et cetera. These professional organizations, 99.9% of the time, on their website will have an advocacy section. And in that advocacy section, it will list what issues and what bills that they are currently personally currently advocating for. So that's one area to take a look at. Number 2 is you want to look at a website called Congress.gov. Congress.gov is a website put on by the Library of Congress. And on that website, which I will be showing you here very, very shortly, on that website they have a listing of all the bills that have gone through this Congress, period. And you can see them in black and white. Another way of looking for pending legislation is to go to those committees that I was telling you about earlier. When you go to those committees, such as the U.S. Senate Health Committee, on their website they list what policy they are working on. So you want to reach out you want to go to their websites and see what legislation they are actually working on. So let's continue forward about a little bit about the research process. So as I mentioned, and on this slide that you can see, I hope you all can see this, this is a screenshot of Congress.gov. And as you can see into the search bar, I just so happened to type in the Patient Protection and Affordable Care Act. So if you type this piece of legislation, if you type this into the search bar, you will come up with this. And you will see right here towards the bottom of the screen, it'll say H.R. 3590, 111th Congress, Patient Protection and Affordable Care Act. You can see who sponsored it, in other words, who introduced it. The person that introduced it in this case was Representative Charles Rangel of New York. And you can see the co-sponsors, who else supports this law. And also at the bottom of this, you can see you can also see at the very bottom what has happened to this law. Has it become law? Has it passed the Senate? Has it passed the House? And obviously in this case it has actually already become law. But for doing the research process, if you click on the hyperlink that says H.R. 3590, that's going to take you to this next page. This next page is going to give you another overview of what of the law itself, and it's telling you about the major action that it's had on the law, and you can see that it officially became Public Law 111-148 on March 23rd of 2010. Now at the bottom of this page, you can actually get a summary of the law. You can see the actual text of the law if you click on that tab, and you can see the titles of the law, and you can see all 506 amendments to this law. And so this is where your research starts. And for this particular law, if you want to know what some of the issues are within this specific law, then you can go into the text itself, or look through the titles, which is going to give you a table of contents, or you can just go read the amendments themselves. So that's how you would do the research. Now here comes the fun part, and that is contacting Congress itself. So first of all, before you contact Congress, it's wise to actually know who your representatives are. And Congress these days has quite a fruit basket turnover rate. It changes quite often with people resigning and elections and so on and so forth. So sometimes it can be very hard to keep up with your own representative. It can be, in all honesty. It's tricky. So there is a fabulous website out there that helps you find out who your member of Congress is. And I've put the link on this slide. And the person so this website is called opencongress.gov.org, and all you have to do is just type in your zip code, and it will tell you who your representative is. So once you've established who your representative is, you then want to go to step one, and that is you want to write a letter and an email to your congressman. Now, in terms of that email, on most congressional websites, they will have an email form that you can go and send them an electronic message right there on their website. When you write a letter and when you write them an email, you want to give them at least you should be able to wait about 1 or 2 weeks before you actually start calling them. You just want to give them time to get back in contact with you. The next step is to, once you have waited about that time period, the next step is to actually call the office or the congressman or senator. The first person again is going to be the staff assistant that answers that call. And when you speak to that staffer, you want to tell them whether you are currently supporting the idea, the piece of legislation or not. So step 3, once you have spoken to that staff assistant, you then want to ask them to speak to the legislative assistant, and you actually want to leave them a voicemail. Believe it or not, the best way to handle that these days is to actually leave them a voicemail. That's the polite way of handling this. And I cannot stress you enough. When you go and contact these congressional offices and committees, you must leave all the vitriol and any other ego at home. They can sense ego coming a mile away. They can sense it coming hundreds of miles away, I should say. And so if you're there yelling at them and complaining, they're just going to tune you out, and it's going to be a disaster. So I cannot stress this enough, that you need to be as polite as possible, because the staff assistants themselves are the gatekeepers. And if the gatekeepers think that you're being respectful to them, they will let you go on through. And that's what you need to do. You need to go on through to help get your idea out there. So, getting back to the staff assistant, as long as you're being polite, you want to ask again to leave a voicemail with the legislative assistant. And then you will wait about 2 to 4 days at least for them to return your call. And then you basically want to ask them on that call to set up a meeting with them. And when they do grant you that meeting, you want to be as polite as you can with that legislative assistant. Number 2, very, very important, is that you want to get, when you're speaking to this legislative assistant, you want to get very, very, very specific about your actual issue. If you speak to them about your issue in very, very broad terms, you're not going to get anywhere. That's going to cause them to go back and have to do an awful lot of research, and they will have to go and have to try to find a lot of answers to the multitude of questions they will have. The more specific you can get with them, the less work they will have to do, and the more they are likely to like you and want to help you out. So again, step 5, if there is legislation regarding your issue, again, you want to encourage that staff assistant, that legislative assistant, I should say, to encourage their boss to support it. If there is not any legislation on your specific issue, you want to encourage them to encourage their boss to introduce legislation on your issue. And at the conclusion of that meeting, you want to thank the legislative assistant for their time. You want to handwrite, you want to make sure that you handwrite a message to them as well as a thank you letter. This goes a long way, and they enjoy you taking the time to thank them. That goes a long way. They are human after all, so keep that in mind. So this is an example of a successful advocacy campaign. This was done by my boss. My boss is a former, he is a current family internist. I'm sorry, he's a current internist out in Hawaii. I apologize. And so he is trying to develop a direct primary care a program and take it across the country. So he wanted wanted to get his idea out in front of Congress, and he did. And he actually was very lucky. He was able to speak to an actual member of Congress directly. The congressman loved his idea, then sent him on to the legislative assistant. And the congressman and the legislative assistant worked with him on his idea. And they decided that they wanted to get his idea in front of Medicare and Medicaid, specifically the director of the Center for Medicare and Medicaid Innovation. And as you can see, this is exactly what happened. This is a letter that was sent on behalf of Congressman Alan Grayson to the director of the Centers for Medicare and Medicaid Innovation. And my boss was able to not only speak with the director, but also speak with the with other staffers within CMS and HHS. And we consider that to be very successful because he was able to get his idea in front of not only just a member of Congress, but now also the federal government. What I'm trying to stress here is my boss is just a Joe Schmo. He's just an internist. All right, he's not a lobbyist. He's not a big time bigwig. He's not. I mean, he's not a big congressional donor. He's not a lobbyist. He is Joe Schmo. If my boss can do this, then so can you. The process that I've given you today is a little tricky, but it will work if you just stick with it and if you stick to my plan there. My plan does work because in 2011 and in 2012, my boss used this tactic, and it worked perfectly for him. I do want to give you another short little story here, if I may, in regards to how small individuals can actually make a huge impact in Congress. Believe it or not, you actually can. When I was on the House side in 2007, working for a member of Tennessee, we had a hospital CEO actually come brief the congressman. And this hospital CEO came up and said, came up to us and said, you know, I am a hospital CEO. This is what I'm dealing with. I'm dealing with reimbursement issues. I'm dealing with I'm dealing with Medicare issues. I'm dealing with Medicaid issues. I'm dealing with this. I'm dealing with that. You know, this XYZ bill just came into play, and these provisions are now having XYZ effect on me and my staff and my physicians and my patients. And so I was in that meeting, and it was a great meeting. So at the end of the meeting, and after this particular CEO had left, the congressman looked over at me and looked over at the legislative assistant that was sitting in the room as well, and the congressman said, "Boy, guys, that was the best meeting I've had in a long time." And I said, "Why, Congressman? Why was that the best meeting you've had in a long time?" And he said, because that was A, not a lobbyist. B, that was Joe Schmo. C, that was a hospital executive, an expert in hospitals, as what the congressman said, and said that was a guy that came out and took his time out of his busy day to come to D.C. to tell me exactly what's going on in his particular hospital. And the congressman said, to me, that is fantastic, because here is a guy, tell me exactly what's going on, and now I know exactly what kind of impact legislation is having on him. How good of an impact it's having on, or how bad of an impact it's having on him. And the congressman was just ecstatic with that kind of feedback. And what was really making the congressman ecstatic was one thing and one thing only. Can anybody guess what that is? Well, I'll just tell you. It was because that individual got specific about his idea and about what was going on with his hospital. He got very specific. He did not use big, broad terms. He got very specific. And unfortunately, in this day and age, when it comes to advocacy, people tend to speak in very broad terms. The lobby association groups are well known for speaking in broad terms, and that necessarily is not good, and especially to us people who are actually drafting laws. That's not good at all. You know, we want to know about specifics. We want to know how exactly do you think this piece of legislation, this provision, is going to affect you. We want to know that. And so it can be very helpful to us in the committees and as staffers if you tell us specifically what kind of problems you have, or if you like it, we want to know that too. But my whole point is, and what I'm trying to sum up here, is that you need to get very specific. As long as you get very specific, you're going to go a long way. The advocacy process will go a lot smoother for you. You will have a much larger chance of getting your actual issue out there if you simply take the time and give us very specific details. As long as that happens, there will absolutely be nothing that will stop you. So, with that being said, I thank you all very much for joining us today. I hope I have given you all some great information on how Congress and the legislative process works. With that said, Abraham, are there any questions?
Yeah, we've gotten some great questions, Matthew, so far, and we want to just remind everybody to go ahead and ask any questions you have in the chat box. We're going to try to get to as many as we can, but if for some reason we can't get to all of them, we'll be able to have Matthew or myself contact you a little bit later date. And Matthew, do you have the slide that shows our contact information, just so people can see?
Yes.
How to get in touch with either us or you?
I sure do. It's right here. Is that slide, and I will leave all that. I'll leave this slide up for you all.
All right, great.
I won't move it.
Okay, so the first one I wanted to get to, just because I think it's probably on so many.
I'm so sorry, everybody. I just wanted to let you know there is a slight typo on this slide. My website is actually medicalaccessusa.com.
Okay, so I'll type that in the chat box here.
Just wanted everybody to see that it's medicalaccessusa.com.
medicalaccessusa.com. Okay.
My email address and the phone number is correct on that, just to let you all know.
Okay. So the first question I want to get to is just about an issue that I think a lot of practices have on their mind right now, or maybe even are trying to put off having in their mind right now. But Brad wanted to know what you thought it might take to get the transition to ICD-10, currently scheduled for October 1st, delayed. What sort of political effort would you suggest if that was one of your goals?
Well, and actually, too, Brad, thank you so much for the question. I appreciate it. In all honesty, the ICD-10 issue is a major issue right now, and it is going to have huge financial impacts on a lot of practices here. So obviously, it's a major thing. Before I answer your question, if I can say this, and if you will remember, remember to the slides that I was showing you. Who the actual healthcare members of Congress actually are. If you want to have any kind of issue brought before Congress that is healthcare, those are the individuals you need to specifically target. Why? Because they are healthcare professionals, and they are obviously going to know exactly what you're talking about. they will basically tell you, oh, been there, done that. We know exactly what you're talking about. So they, of all people, are the right people to talk to, and obviously they will champion your idea. They will champion it. I promise you that. And so so for ICD-10 and trying to get that delayed, you would want to reach out to those healthcare professionals and tell them that you would like to see this either move forward or delay. I mean, I'm not telling you what to do here, but I'm just saying you need to come down on either one side. Now if Brad, if you will hear me here for a second, let's just say that you do want to see this delayed. So you would then go through my process, and you would reach out to those individual physicians and nurses about getting this delayed. And I cannot stress this to you enough, is that when you reach out to them and you tell them why you want this delayed, you have to get specific. The more specific you get, the better this will be. If you're trying to say, well, ICD-10 should be delayed because it's really expensive, then you need to tell them how expensive it's going to be. You need to say, I'm a practicing physician. It's going to cost me XYZ dollars if this doesn't get delayed. I mean, you need to get that specific. And again, the more specific you get, the better it will be.
So it's not enough just to go to a representative or to somebody even in a state government, or wherever, and say, this policy is going to be expensive for me. This policy is going to mean more time, more money lost, keeping compliant. You want to be able to say it's going to cost me this much more, this percentage. We've heard a lot of people specifically with ICD-10 saying that, it's in order to reasonably transfer to ICD-10, you're going to want to have 3 months of cash sort of, in savings held back just in case things don't go well, which that's quite a bit to ask. So,
yes.
Having that kind of specific impact, I think, is what Brad was asking here. And Brad had a follow-up here. Brad says, so we need to reach out to those members who are doctors or those that are part of healthcare committees, or should he be trying to reach out to both, do you think?
Both.
Okay.
Brad needs to be reaching out to both. And obviously you want to start with the healthcare guys, because obviously those are the people you want to talk to, right? They're healthcare guys. Those are the most obvious ones to talk to. And then you can slowly but surely reach out to those other members on those committees as well. But you want to start with the healthcare guys, because they are going to understand what you're doing right now.
All right. Well, thank you again for the question, Brad. The next one we got was from Kim. Kim says she works for physicians in a practice management consulting firm, and she represents several doctors that are all suffering with a certain issue with a specific insurer. So she's got kind of a specific a thorn in her side right now. So she says, do you suggest when reaching out to advocacy specialists that these inquiries come directly from the doctors or from the staff members? So I think she's trying to ask, who do you think sort of making the request or sort of saying, hey, we're having this problem is going to have more impact?
Can you say that again? I'm trying to process this.
So what she's saying is that she's having a hard time with one of her payers, and it's not it's not a general thing. It's that several of her clients are having the same problem with the same payer. So she's asking as she tries to reach out both to people that both to representatives and other sort of professional advocacy groups. Should she be doing that from the mouth of her doctors in terms of communications from them, or should she be doing it from the frontline people like billers and coders that are having the specific issue? Whose voices do you think she should sort of start out with in that process?
It depends. It depends, Kim. Who's having more issue with this? All right. Is it Is it the physicians? Are the physicians really having a really difficult time with this specific issue? Or is it those billers and coders? I mean, the ones that are having the most issue with, that's who you want to start out first with. Okay, so you want to use that person who you think is going to have the most influence. All right. So, for example, I'm a pediatrician. My reimbursement is getting the daylights kicked out of it thanks to XYZ insurer. Who do I go to complain about this? And I want to let Congress know about this too, right? So, if I'm a pediatrician, I'm just going to go straight up to that physician on those healthcare committees and say, listen, from one doctor to another, this is what's going on. I am really serious about this. I can't make this happen. I need your help. And they'll say, okay, we'll figure out what we can do. So there is a direction that you can go with that. But besides Congress, if you remember my little spiel that I gave you as well about the other lovely branches of government, specifically the more along the executive branch side, such as your HHS, your Department of Insurance. You want to reach out to those individuals as well. You want to do that as well. And so I hope I've kind of answered your question on that.
Yeah, and one thing I would just say is that I think that the physicians are always going to have a little bit of a larger voice in terms of sort of not credibility, but in terms of the respect they're given in their field, and in terms of the sort of the dominion they have over the field, even if physicians aren't always sort of at the front line of what's going on. I would say that having them speak, because ultimately the success or failures of the coders is the success or failures of the physicians and the practice and the patients. They're all sort of tied in together. So
I agree.
I would say for Kim that to really lead with a strong physician voice would be a great way to sort of make the most impact at the beginning. Did you have something you wanted to add to that, Mary Pat?
Did you turn my
my
volume back on?
I did turn your volume back on. I thought I heard you getting ready to say something. Never mind.
No, just breathing. I do think though that Lonnie commented. Her comment was really good. She said the state AMA Society and the Physicians Foundation regarding the carrier. The Physicians Foundation, I'm very familiar with them, but I've not used them as an advocacy tool. So I thought that was a great suggestion from Lonnie. So thank you very much.
Yeah, thank you, Lonnie. That is an excellent idea. And Anna Dorr, I'm sorry, Anna, I'm not sure if you're a physician or not, so I don't know exactly how to address you, but this question that she asked caught my eye here. And so, you're an administrator. Thank you for correcting me. I appreciate that. I see that. She's asking a really good question here. She's saying that her practice has had a significant impact with the health exchange insurances. She's saying, where do we start to address the fact that the insurance decided who is to be included and who is a part of the exchange? This is this is a really good question that you ask, Anna, and I appreciate you asking it. When it comes down to the exchanges, this is where it gets very, very tricky, because as you know, the exchanges can be controlled by the states and they can be controlled by the federal government. So it depends on where you're actually, where you actually are in it, and that is if you're in a state where the exchange is actually controlled by that state, then you just reach out to the Department of Insurance. You're in Florida, okay. That answers another question there. And I forget who's running that exchange. Something tells me it's probably the federal government that's running that exchange, but I'm not sure. If it is the federal government, unfortunately, the only thing you can do is to talk to HHS and get into HHS, and trying to find the right people within HHS about this is like trying to find a needle in a haystack. because the because the executive branch is very, very large, and it's hard to find out. Although I will give you this little personal tidbit information about the executive branch in regards to HHS that not a whole lot of you might know about. And that is, HHS, obviously being public, publishes everything you can possibly think of, and they make it public for the most part. So, for example, if you, Anna, are trying to find a specific person within HHS, within a specific department of HHS, that's actually made a little easier now because HHS publishes their entire employee directory. And all you have to do is you do a simple Google search. You'll type in HHS employee directory and bingo. And then within that directory as well, they will list who is actually in what department. And so there are people within HHS that handle the exchanges. So you can go through HHS and find the individuals that that deal with the exchanges and call them from there. If this is a state thing, you can always, period, regardless of whoever controls your exchange, you should always go to your Department of Insurance for any insurance issues. You want to go directly to them, and they, I'm sure, will be happy to give you as much information as you need and as much help as you possibly need as well. I hope I answered that for you.
All right, well, we've got about 4 minutes left here before the top of the hour. So I've had a couple people actually ask me in a couple of different ways a kind of common theme question that's just basically like, how do we keep up with all this? Administrators like Anna, physicians, and people that are working in practices are so busy these days. And so I've had a couple people message me privately and just sort of say, what's a good sort of source to kind of get kind of top line, just real sort of brief summaries of what's going on in these areas that could affect my practice. Where would you suggest to go to sort of keep abreast of this kind of stuff?
Well, follow the committees. Follow those 6 specific committees and just follow them constantly. Actually, of those 6 committees, there are actually really 2 that you should follow, and that is the House Energy and Commerce Committee and the U.S. Senate Health, Education, Labor, and Pensions Committee. I do have a little personal bias towards them for obvious reasons, but the Health Committee winds up being, along with the Energy and Commerce Committee, wound up being perfect for you all to follow because these are the major healthcare committees in Congress.
Matthew, I think there was a slide. You might want to flip back to that slide that you kind of skipped over. If you can flip back to that one slide that talked about the professional societies. Just use your, I think your up button will get you back.
Let's see. No, I've kind of screwed that up here. Bear with me, everybody. I think I know where, well, shoot. Let's see, where was that in the talk?
Well, let's bring it up to full screen. Bring it up to full screen and just keep on flipping, and I'll tell you which one it is.
Ah,
right
this
there.
one? Okay.
Yes.
Yes.
I think that's a particularly good slide for people. When you say keep track of all 6 committees, I think that's pretty impossible for most people. But I like that you called out these 2 committees, and here are the websites. Here are the links for their websites. But the professional organizations, too, do a tremendous job in following. I liked your advice very much about, MGMA, ACHE, the professional societies. They're going to, on behalf of their members, are going to do a really good job keeping up with things that are introduced. So definitely start there. And, you know, that's what everybody pays dues for, is for them to keep you on the leading edge of advocacy. And for some reason, if your professional society doesn't do that, ask them to. You know, that's typically part of every professional organization.
And also, too, Jackie Abraham asked a great question I was hoping that you would weigh in on. So Jackie Harrington, she put in the chat, and I hope you weigh in on that here in a second. But, so I'm sorry, I just noticed that personally. So, but no, Mary Pat is absolutely right. And if there is something else that I've noticed that I can say here, too, is that, you know, because of the way that our society is, and, you know, we live in a fast news-paced 24-hour cycle, it's really harder and harder to believe the stuff that you see on TV. When I was in Congress, I was told never, ever, ever believe anything that's put out by ABC, Fox, MSNBC, CNN, CNBC, etc., etc., etc. Why? Because their job is to not only get out the message, but to spin it based upon what their news executives want. That is their goal, and that is what they do. So when it came to getting down to the ACA, there's not one news outlet, period, right now that has gotten that bill correct. Not one. They're close, but they're not correct. And
Matthew, we're going to have to stop. We're at the end of our time.
Sure.
And
what I'm getting at is
Jackie's question.
Yeah, sure. But really quickly, if I may, I do want to say here that the best places for you to really understand what is correct, even about the ACA or any other legislation, is the energycommerce.house.gov website and the help.senate.gov website, because that's where the correct information will be.
Okay, well, to answer Jackie's question real quick, I just want to let everybody know that there will be an email coming out about an hour after we conclude here that'll have both a link to grab the slides again, as well as we'll be sending out more information about where people can view the replay. The replay will be available shortly after this. So thanks, everybody, for coming. There will be a brief evaluation that'll pop up after you close your window, and we just want to thank everybody for coming out today. Have a good one.